What is Lyra and the Employee Assistance Program, or EAP?
My name is Kirsten Segla, and I'm the Customer Success Manager for Lyra Health. Lyra is the University of Minnesota's Employee Assistance Program. And Lyra was actually founded to make mental health care accessible to those who need it to help them feel better faster. All of Lyra's providers have been vetted for their expertise, effectiveness, and use of evidence-based practices. Really, the goal is to help you build skills that will help you in your everyday life. So the Lyra benefit itself for the University of Minnesota employees is available to the employee themselves, their spouses, and their dependents, and they have access to 8 coaching or therapy sessions per issue that they are experiencing. And for those enrolled in the University of Minnesota Medica Medical Plan, you have the option of continuing care with your same provider after those 8 sessions. However, the sessions after the initial 8 session are subject to mental health outpatient cost sharing as outlined in the medical plan. So Lyra can actually help people who have a variety of different issues that they're experiencing. This can be things like anxiety, depression, feeling overwhelmed, parenting support, and alcohol use. And Lyra, you can meet with your provider either in person, virtually, over the phone, or with live messaging. And one thing that I think it's important to know is that EAP is more than just coaching and therapy. It's kind of this whole suite of things that is there to help you. The first is work-life services, and that includes support for legal needs, identity theft support, and dependent care support. And it also provides access to things like mental health workshops and courses.
What are some of the ways Lyra can help supervisors?
So one of the reasons we have managers reaching out to Lyra is for something that we call manager consultations. So if you are faced with a difficult conversation with an employee, Lyra can help you navigate this. So what you'd need to do is call into our Care Navigator team and then actually request a manager consultation. And they're going to ask you some questions about like what's going on, what the situation is, and then help determine if this is an urgent request or if this is a non-urgent request. For any urgent requests, a care navigator will actually call you back within 1 hour to have that conversation. For a non-urgent issue, it could be about a business day to have that complete conversation. In situations that you might use the manager consultation could be things if you are noticing an employee who's withdrawing from work, or if a teammate has passed away and you need to inform others about what's going on. If you think, a team member is experiencing symptoms of depression or anxiety, and you want to talk to them about the Lyra benefit, but you don't necessarily know how to or what words to use, our Lyra team can really help with that. And one thing that I always like to call out are manager consultations are included with the Lyra services, but don't count towards your personal sessions. So if you call in for a manager consultation, that's not going to count towards those 8 sessions that you personally get as a University of Minnesota employee each year.
What do you wish supervisors knew about the Employee Assistance Program?
So a couple things that I want them to know is that EAP, or Employee Assistance Program, is not just for those who have an urgent need. EAP is really here to support the whole person where you are. So it can be small things. If you notice you're getting irritable with your family or feeling overwhelmed or just don't feel like yourself, those are all very, very valid reasons to call Lyra or to go to the website and kind of investigate care. You don't need to have these big, overwhelming feelings in order to start the care process. And our care programs actually meet you where you are. So we have things like Lyra Essentials, which is a repository of mental health information, has videos and meditations and things like that. And then we also have our coaching program, which is a bit less clinical in nature than our therapy program. So we kind of have a variety of different options to meet the person where they're at.
Where can supervisors find out more about the Employee Assistance Program?
So to learn more about Lyra, I would recommend you going to umn.lyrahealth.com. lyra.com. This is where you're going to find information about how to reach a provider, access to our Lyra Essentials, and access to those work-life services that we had discussed if you are looking for support on legal managers, identity theft, or dependent care support.